Welcome to eCareDiary.com's Caregiver Tips and Clips. I'm your host Meghna Giridhar. Each week we will focus on a caregiving issue in the form of a short educational video. The subject of today's video is what you need to know about osteoporosis. Osteoporosis is a disease of the bones occurring when too much bone is lost. Bones weaken as a result and may break with something minor such as a fall. About 54 million Americans have osteoporosis and low bone mass, placing them at increased risk. Studies suggest that approximately 1 in 2 women and up to 1 in 4 men aged 50 and older will break a bone due to osteoporosis. A healthy bone under the microscope looks like a honeycomb. When struck by osteoporosis, the holes and spaces are much bigger than they are in healthy bones. This indicates lost bone density or mass or abnormal structure of the bone tissue. As your bones become less dense, they also become weaker and more likely to break. When you're young, your body makes new bone faster than it breaks down old bone, and your bone mass increases. Most people reach their peak bone mass by their early 20s. As people age, bone mass is lost faster than it's created. There are a variety of risk factors for osteoporosis, including your age, race, lifestyle choices, and medical conditions and treatments. Some of them include being over the age of 50, being female, low body weight, that is being very small and thin, and menopause. The reduction of estrogen levels at menopause is one of the strongest risk factors. A reduction in the size of your stomach or a bypass or removal of part of the intestine also limits the amount of surface area available to absorb nutrients, which can also cause osteoporosis. Long-term use of medications interferes with the bone rebuilding process too. Osteoporosis has been associated with medications used to prevent seizures, gastric reflux, cancer, and transplant rejection. Osteoporosis is more likely to occur in people who are anorexic and have low food intake. Low food intake can reduce the number of calories and the amount of protein and calcium ingested. Some bad habits can increase your risk of osteoporosis. Examples include an inactive lifestyle, which involves people who spend a lot of time sitting around than those who are active. Regular consumption of more than 2 alcoholic drinks a day also increases your risk. There are typically no symptoms in the early stages of bone loss, but once bones have been weakened by osteoporosis, you may have signs and symptoms that include back pain caused by a fractured vertebra, loss of height over time, a stoop posture, and a bone fracture that occurs much more easily than expected. If the risk is not high, treatment might not include medication and might focus instead on lifestyle, safety, and modifying risk factors. Treatment recommendations are based on an estimate of your risk of breaking a bone in the next 10 years using the bone density test. This is done by a machine that uses low levels of X-rays to determine the proportion of mineral in your bones. During this painless test, you lie on a padded table as a scanner passes over your body to check hip, wrist, and spinal bones. For both men and women at increased risk of fracture, the most widely prescribed medications are bisphosphonates. Estrogen, especially when started soon after menopause, can also help maintain bone density. Here are some suggestions that can help reduce your risk of developing osteoporosis. The first one is no smoking. Smoking increases rates of bone loss and the chance of experiencing a fracture. As explained earlier, avoiding excessive alcohol can also be very helpful. When it comes to falls, to prevent falls, wearing low-heeled shoes with non-slip soles and checking your house for electrical cords, area rugs, and slippery surfaces that might cause you to trip or fail might help you deal with the risk. Keeping rooms brightly lit, installing grab bars just inside and outside your shower door, and making sure you can get in and out of bed easily are some other steps that can be taken. 3 factors are essential for keeping your bones healthy throughout your life. They include adequate amounts of calcium, adequate amounts of vitamin D, and regular exercise. Men and women between the ages of 18 and 50 need 1000 milligrams of calcium a day. This increases to 1200 milligrams when women turn 50 and men turn 70. A good starting point for adults for vitamin D is 600 to 800 international units a day through food or supplements. If your blood levels of vitamin D are low, your doctor may suggest higher doses. If you start exercising regularly when you're young and continue to exercise, it's a great protective measure against osteoporosis. Combine strength training exercises with weight-bearing exercises. Strength training helps strengthen muscles and bones in your arms and upper spine, and weight-bearing exercises such as walking, jogging, impact-producing sports affect the bones in your legs, hips, and lower spine. Swimming, cycling, and exercising on machines such as elliptical trainers can also provide a good cardiovascular workout. There is evidence that competitive cyclists have reduced bone mineral density. They should combine strength training and weight-bearing exercises and consider a test for osteoporosis. May is Osteoporosis Awareness Month. It is good to know that it's a preventable and treatable disease, but it's important to start working towards getting healthy bones by making necessary lifestyle changes today. Thank you for joining us today. To access more caregiver tips and clips, visit us at www.ecarediary.com. Until next time.